16 million American caregivers provide care for Alzheimer's and dementia patients. That number is going to double in the next 20 years. Being a caregiver is physically and emotionally exhausting. These individuals experience a massive amount of stress, worry, loneliness, and depression. They need tools to help improve their quality of life. I'm John Corky, and I'm the founder of Amissa. Over the last 2 years, my company's conducted nearly 300 customer discovery interviews through programs like Venture Prize, the Ignite program at Stanford, and through programs like NC Ideas Microgrant. Families tell us that they want to use technology products to improve their life and to protect their family members, but they cannot find the products that they want. They express to us that products are either bulky, they're outdated, they have large monthly fees, or they just don't work. Sorry. Last year, in collaboration with the University of North Carolina, Amissa developed a prototype application that enables multiple family members to remotely monitor the health and location of a patient and receive wandering and fall alerts. We are raising $700,000 in non-dilutive and dilutive funding to develop an MVP and begin pilot testing with university systems and healthcare providers. I'm seeking a full-stack iOS developer, potential co-founders to join our team. That's it.
Good job. You know, one of the things that is usually useful in a company like yours is to really speak with passion, and I think you did that, and you want to make sure you keep that, because I think that's what entrepreneurs invest in the end. But I think you could have also tightened up your description of the product itself. I mean, you started great, setting the problem. I mean, it is not a problem that is that hard to explain, because I think a lot of people see it. It's a big problem, but I came away confused or not understanding clearly in your 2-minute pitch exactly what you're selling, exactly what your product or service is. And I don't know that I want to have a cup of coffee with you afterwards after that pitch, because I hear about other products, and I don't want to just sort of say, okay, here's another product. But I have a feeling that if you focus a little bit more on that piece, describing a little bit better what you do, how you do it, and how you're differentiated, maybe that would change. So can you tell us a little bit more about?
Yeah, so
your
I do have to nail down that 2-minute pitch. I've never done this, and usually when I do pitch, it's longer, and I end up crying. And I've had VCs. I was at Stanford last year, and I had VCs that said, I've heard thousands of pitches, I've never cried. I'm crying. So it is emotional.
That's okay. I think crying is okay.
So the product is, you know, we're still early, but what the product would be is a monthly subscription for an app on an Apple Watch that enables multiple individuals, an entire family, and your neighbors to help monitor your loved one. Because what we've realized is that generally in Alzheimer's, one person, usually a woman, a daughter, gets stuck with doing the care. I met somebody yesterday, she said the same thing. You know, I get stuck with it even though my brother lives in town. When we talk to families and they say, if I had that information on my phone, I know my sister does this, I can help and I can say, you know what, I got it today. Let me help you. So, or if you have a job and you have to go to work every day and you're worried about your mom being at home, this helps you realize, did mom wander? Especially in those early stages before you put her into managed care. We're helping families to extend the aging in place. So yes, I do have to work on the pitch.
That's important to really narrow down the problem that you're working, especially in a space as big as this. Have you looked at the competition? Have you looked at what else is out there? Have you tried to buy something like this?
Yes.
And what happened? Tell us about that.
So I've been working on this for 2 years. I've been contacted. This whole started with me being contacted by the FBI. I was doing research at MIT. My background, I did special operations for 25 years, and I protected the president. My last 2 years, I was doing research on building nascent tracking devices for the government. FBI said, hey, we need a product to help families. I've spoken with the leading experts in wandering devices. And I say, what would you use? And they say, John, they all suck. And this is why. They're not waterproof. There are devices that work, but they use 1950s radio frequency technology, but they don't tell you when your caregiver or when your loved one wanders. We can find the person hours later, but that's a difference between life and death. Somebody could wander out, get hit by a bus, or trip in a creek, and nobody knows where they're at. We have looked at all these devices. We're working with the Alzheimer's Association and the leading people at major universities around the world.
So the fundamental premise is that if you know the location and sort of the vertical status of a person, that somehow that lessens the worry burden to a caregiver, to an absent caregiver. Is that right?
So I got 2 minutes. So there's a lot of things that we want to do. We know that for certain patients, when they're sitting down for hours, as soon as they get up, they have to go to the bathroom. We can send an alert to say, hey, your mom just got up. You should go attend to her before she soils herself. Our long-term pitch here is we're using all this data, the behavioral and the biophysical data, to build longitudinal models to hopefully delay the onset of the disease. We know that there is no cure right now, and medicines are not working, but there is a growing movement that believes that the right amount of exercise, the right amount of sleep, and taking care of your body can help all of us delay the onset of the disease. However, the researchers that I'm working with, they have not been utilizing wearable technology in a manner that can help them. They want to work with us. They want to use my product, but we need to build it and then do pilot testing with them.
Yeah, it was good.